Welcome to TimeOut, an exciting new educational video series brought to you by First Case. In this series, we're bringing you easy-to-access education with no fees and no tests. Break free from boring staff meetings and dive into educational content that you can put into practice immediately. So let's get started with today's episode of TimeOut.
Welcome to TimeOut. Today, we're going to be talking about surgical counts. Now, I'm going to assume that all of you know how to count to 5 or to 10 or even 247 if you're in a big plastics case. So we're not talking numbers today, but we are talking about how to count. Of course, every facility has rules regarding counting, and you have to follow the policies. But there are still best practices surrounding surgical counts, and those are what we're going to address today. But first, let's talk about what counting is not. Counting isn't eyeballing everything you've opened and then just writing down what's supposed to be on your back table, or writing down everything you know you're going to open before you've actually opened it. It's also not looking at a pack of laps and saying 5 or a pack of pops and saying 8, instead of individually counting the sponges or the suture. And emergencies aside, the first count should always occur before the procedure starts. In all of these situations, you haven't confirmed that what you think you have is what you actually have. And that puts your patient at risk for a retained surgical item. I've seen a pack of laps with 4 sponges and a pack of laps with 6, even though they're supposed to always have 5. I've seen 9 or 11 Ratex instead of the standard 10. I've seen 2 needles inside of a 1 suture pack, and I've seen 9 needles in a pack that should have had 8. It happens. Our supplies are not without error, and it's our responsibility to know what we're starting with so that we can confirm that we still have everything at the end of the case. A retained surgical item is considered a never event. This simply means that it should never happen. Taking the time to properly count instruments, sharps, and sponges helps us prevent this kind of surgical error. So, let's talk about what a proper count should look like and what it should include. First, sharps, sponges, and instruments should be counted and or accounted for on every surgical case. This also includes anything put into the patient during the procedure, like sterile towels or packing. Anytime anything is packed inside the patient, the scrub tech or scrub nurse should inform the circulator so that he or she can make a special note of those packed items. And when they come out, that should be communicated as well. By noting packed items, we make sure that we are aware of their location during the closing count. Second, the scrub person and the circulator should count everything together, both before the procedure and as items are opened during the procedure. This is really important. With 2 sets of eyes looking at everything, it decreases the chance of error or miscount. Third, the circulator should immediately record the count for each item. During the first count, having the count sheet in hand makes this a pretty simple process. During the case, open the item, confirm the count with your scrub person, and then immediately write it down. This reduces the chance that you'll forget, and it helps prevent an incorrect count at the end of the case. Fourth, counting should be repeated if there are any interruptions or if there are any errors in the count. An interruption may cause you to overlook an item or forget to count something. And if you do come up with an incorrect count, your first step should be to count again to confirm. If it's still wrong after that, then you start looking on the floor and in the trash and follow your facility's procedures for an incorrect count. And finally, number 5, an additional count should be performed anytime there is a question about the count and anytime the scrub person or circulator is permanently relieved. The person relieving should verify that all counts are correct prior to taking over, and the person being relieved shouldn't leave the room until the counts are confirmed. And remember, the scrub person and circulator who perform the final count, the one at the end of the case before the patient leaves the room, they will be held accountable for the entire count. So make sure that you verify everything before taking over. When we take the time to count properly, we are confirming that we know how many instruments, sharps, and sponges we are starting the case with, and we know that we're ending the case with the same amount. We are protecting our patients from an infection or an additional surgery due to a retained surgical item. And we're also protecting ourselves and our coworkers from any unintentional injury due to a sharp lost in the trash or turned in with the instrument trays. Protecting our patients, our coworkers, and ourselves from injury is vitally important. Just because you know that you always open 10 Raytex, 2 suture needles, and 1 injection needle for your case doesn't mean that that's what's on your back table, unless you take the time to visualize what you've opened and count it out. Our patients are depending on us to do it right every single time. And with that, that is all the time we have for today. I'm your host, Melanie Perry. Thanks for watching.
That's going to do it for this episode of TimeOut. As a reminder, you can help support us with a like, a share, or by subscribing to this channel. You can also subscribe to the First Case podcast on your favorite podcast application. I would appreciate a rating and a review because your feedback is important to this show. On behalf of everyone at First Case, thank you for watching this episode of TimeOut.